Hi, everybody. Welcome to Healthline. I am Gregory Zarian. Happy New Year. Hope you had a great holiday. Hope you took some time off. You got some rest. Hope you overate and overindulged and just had a great time with your friends and your families. And you got off the phone. You got up. You got out. And yes, depending on where you live in this country, weather could have been too cold. Could have been a lot of things. Just hope you just took a deep breath and you got to spend time and connect and just be part of a lot of the things that we have missed in the past couple of years. And I hope if you got something you didn't like, you got a gift receipt so you could return it. Our mission here, as it is every year and every episode, is to assist you in being as healthy as you possibly can. So it's 2023. Hope you're still washing your hands. Hope you got your flu shot. Hope you are getting an exercise, eating healthy. Hope you got your COVID shot. You got vaxxed. I wish all of that for you. And if you're not feeling great, stay home, don't go to work, take care of the ones you love, and take care of yourself. So we're gonna start strong this year, and we're gonna start with our feet. We beat our feet up. We are on our feet 24/7. We walk and we don't give the love to our feet like we need to. So what does that do? It causes neuropathy, it causes pain, and there's a lot of ailments and maladies that contribute to our feet. The conversation today is all about diabetic foot care. So joining us for the very first time, he said he's nervous, but I'm gonna make sure he's okay. Dr. Narek Garukyan. He's a doctor of podiatric medicine from Adventist Health Glendale. Doctor, welcome.
Thank you very much for having me.
I'm so glad you're here, and I'm glad you didn't say no.
Thank you for having me again.
So off the top of your head, what is the one thing we need to do in regards to taking care of our feet that we do not do?
The most, I guess, common problem that I see is just selection of shoes that we use for certain events, right? If you're a runner, you have to use a running shoe. If you're a hiker, you have to use the proper hiking shoe. I see a lot of problems with patients using the wrong type of shoe, and that's the major cause of causing some kind of pathology to their feet.
But also, I mean, you, as we're already getting ready to wrap out and go into the next segment, is you also see a lot of people wear the wrong shoe because it looks good.
Oh, definitely. That's the major problem. The fashion industry has kind of come in and taken over and they tell patients what to wear because they're very well advertised, but that's not necessarily the correct shoe for them based on their foot type or just based on the activity that they're doing.
So for all of us that wear shoes that look good, that don't feel good, we're going to give you a solution on the other side. Don't go away. Welcome back. Joining us from Adventist Health Glendale, Dr. Narek Garukyan. He's the doctor of podiatric medicine, and we left you with a little bit of a cliffhanger. So, doctor, thank you again for being here. And people love to look great. I feel everyone loves to put on a great outfit and feel good and look good. And a lot of the times the shoes we wear aren't as comfortable as they can be because of the outfit. What is an alternative solution to still look and feel great and wear shoes that may not be as high fashion, but still as fashion forward and comfortable?
Well, that's a tough question because most people, most shoe companies will try to make it a little bit fashionable.
Sure.
Right. So difficult to answer because it really depends on what you're doing. No one expects a patient or anybody to wear, tennis shoes to go to a wedding or something like that. It doesn't make any sense.
But some do.
Some do because they have to.
Sure.
Right? Because they have the pathology is too bad already and they have to use it so they're not in pain and they can, dance or do whatever they need. But really, a very supportive shoe, there's really three things you're looking in a shoe. One is you get the shoe and you bend it, and it should really bend really at where your toes are bending when you're walking. So number two, if you twist it like a pretzel from side to side, it should be pretty rough. It should not be able to twist really easily. And number three, the heel counter, right where your heel is coming in, should be tough. It should not be soft. And if you have those three components, any shoe that has those three components is pretty well made and very supportive for your foot. You see a lot of the companies made all these kind of like the free run or
Sure.
the shoes that you wear and it feels like you're not wearing anything. That's where I see most of the problems with patients.
Because they don't have a lot of support.
They're not used to it.
Got
so
it.
if you're a person who's athletic your whole life, right, and your muscles and your foot are very strong, internal muscles are very strong, and they're used to barefoot walking, barefoot training, you're going to do fine.
Okay.
But if you're someone who's not used to it, and you wear something like that and go run a couple of miles or do a hike or something like that, you're gonna injure something.
Got it.
Your muscles give up at a certain point, and your ligaments take all the slack, and they can only do so much. So
And that also contributes to pain in the legs, pains in the hip, and then
Definitely.
ergonomically
Yes.
you are just throwing your entire body off.
Absolutely. Yes.
And here's the thing too, for women or people that like to go to events and wear boots, and women that wear the high heels and stuff, there's also inserts and insoles. And if there's just solutions that you can apply to your foot hygiene.
Absolutely. They make inserts, you can get custom inserts, or they
Love that.
sell commonly inserts for all kinds of shoes. And it's really kind of tough to get the correct one for yourself, so you make sure you get some guidance, because you can get the wrong one and that can hurt your foot even more. But absolutely, they do make inserts for, they do make inserts for dress shoes, tennis shoes, any kind of shoe, casual shoe, boots, whatever patients want to wear.
And here's the
people
thing:
want to wear.
if your feet hurt at the end of the day, or your knees hurt, your hips hurt, or you are just in pain, one great way is to go to a foot doctor, go to a podiatrist. All these running locations now have those new machines where they can check your arch, check your insole, see where you are, see how you're standing.
Yes.
If you're sitting like this, if you're sitting like that, a lot of it starts from the foot up, and just a small adjustment can change. I changed my running shoe. My knees haven't felt better.
Perfect.
This great, and I veered off. Diabetes and our feet. A lot of people I know that deal with type 1 and type 2 diabetes end up having horrible feet maladies, from neuropathy to pain to no pain, horrible burning sensations. Why is diabetes so connected to our feet?
So the problem is that it's the furthest thing from your heart and the blood flow and your spinal cord. So it gets affected by diabetes initially. With diabetes, when your blood sugars are high, it starts to damage the nerves
Got it.
slowly. It also causes kind of like plaque to form in your arteries, just like it does in your heart, but in your legs. Because they're the furthest things away, they get affected first. Actually, the neuropathy is called stocking glove neuropathy because it affects your hands as well. If it gets bad enough, people start getting numbness in their hands and feelings that they shouldn't be, just like they do in their feet. The foot is important because obviously it's your mode of travel, right?
Sure.
It's your car. You get around, and we take it for granted until it gives us a problem. With diabetes, the neuropathy is the biggest problem. Peripheral neuropathy affects 50% of diabetic patients.
And is it diabetes 1 and diabetes 2?
It doesn't matter.
It doesn't matter.
No, it's all combined. So diabetes 2 is the most prevalent. Diabetes 1, type 1, is when patients are born with some kind of an issue. We don't really know exactly. It might be a viral infection that causes, your pancreas to stop producing insulin, or those cells to, get maldeformed. But diabetes 1 is less prevalent. Diabetes 2 is the one that's related to adult onset. So basically, based on your diet, your activity level, obesity, all that kind of contributes. Your diet really, it contributes. In the United States, we have a very, very prevalent number of diabetic patients.
You mean, and we're gonna put a pause real quickly here. There is a total of 37.3 million people in this country that have diabetes. That is 11.3% of the United States population. Did you know that we are the most obese country in the world? Yeah, I'll leave you with that. I'll leave you with that. We'll see you on the other side. Don't go away. Welcome back. I am Gregory Zarin. The conversation today is all about diabetic foot care and also basic general foot hygiene and wear the right shoes. Joining us from Adventist Health Glendale is Dr. Narek Garukyan, Doctor of Podiatric Medicine, or in short, a DPM. Doctor, staggering that we are the most obese country in the world, and we are surrounded by so much health and lifestyle, and if you do this and then you do that, but we are a quick fix country that will go through drive-through, that don't take care of ourselves as much as the rest of the world does. What are your thoughts to that in correlation to?
I agree. The problem is we are always running around. It's our lifestyle. Everyone's always running around to the next thing, and always in a hurry. At least we are in the big cities.
Sure.
So what's the fastest way to get food is the drive-through. You don't have time to cook. You don't have time to do anything else. It's unfortunate that that's the way the lifestyle is. And I think that's a major contributor to this issue.
We don't wake up obese, and I am not negating that there are people that there's hereditary, there's family genes, there's genetics that contribute to people that nationalities and cultures that just are born with slower metabolisms, larger frames, so I'm acknowledging all of that. But when someone wakes up and they used to be leaner, and then all of a sudden they are diabetic, they have heart problems, and they look over and there are stacks of pizza boxes, and there's all these shows now that talk about obesity and the lack of self-care or the lack of self-will and mental instabilities. And there's so many cases that talk about that. And on the other side, there's so many resources that we now have, especially in this country, where someone is saying, let me take your hand and help you and guide you and share with you that it takes one step at a time to get your healthy on, to get your lifestyle healthier and more productive. What do you think we can do so we don't suffer from this anymore?
I think you kind of answered the question. It's a lot of education. There's a lot of miseducation out there. There's a lot of advertisement that's very good, and it's focused to a group of people who are uneducated about what they're eating and if it's good for them or not. And the miseducation is the major problem. I'll give you a little fact. I was born in Armenia. I didn't know about pizza or hamburgers or any of that stuff until I moved here and a few years later. We didn't have any of that. It was home cooked food, and I don't want to knock pizza and hamburger, whatever it is. Sure, it's everyone can indulge once in a while, but when that's the norm, that's the issue.
Well, I was brought up the same way you are.
Yeah.
My dad was, Armenian. My mom is German, so everything was homemade. And what we did as a family is, I know a lot of you parents are going to hate this, but we were in the kitchen with our mom. We were cooking. We were participating. We were doing it as a family. And we've had guests on this show that, as long as it takes you to go to the drive-thru, sit and wait in line, get the food, come back, you can make simple, easy, healthy meals, with just a few ingredients. So we have choices that we can make that can, we've had people on the show, doctors on the show here that have say, when you're pre-diabetic. So if you're pre-diabetic, we know there's choices you can make to help you not become diabetic.
Oh, yeah.
And I completely segued because I don't want anyone to not embrace the choices that they have. I don't want anyone to have neuropathy. As you were saying, one of the signs and symptoms is diabetic peripheral neuropathy. Some of the signs are, and the symptoms are, pain, loss of protective sensation, foot deformity, ulcers. Then you go into peripheral arterial disease, which is?
So basically, you'll get the same thing that happens in your heart, where you get arteries clogging. The same thing happens in your legs. And diabetes accelerates this problem. Usually we see it in smokers, but
Say that again.
so we usually see this in smokers.
There's a lot of you that know that I'm looking right at you, and here's the deal. Every cigarette you smoke is taking that little bit of time out of your life. Why would you let something so small be so big? And I smoked 2 packs a day for 20 years. I haven't had a cigarette in almost 18 years.
Congratulations. That's awesome.
Thanks. So I don't, it's a choice.
Yeah, right.
Talk to us, doctor, one of the signs and symptoms as well to diabetes and your feet, and I can't say the word, onychomycosis?
Onychomycosis. So common things that we see is, the peripheral neuropathy, the peripheral arterial disease, and then there's little things that are cosmetic for patients, but really it's one of the first things that brings them into the office.
Vanity.
Yeah, unfortunately
Let
it
your
is.
vanity bring you
Right.
into the doctor and put down that, you know what I'm saying?
Yeah, so thickened toenails, fungal toenails, or dry cracked skin, which is another form of kind of a fungal infection in the foot. And we see that more in diabetics because of the diabetes, the immune system drops and your body is no longer fighting those things on your skin. The fortunate thing is it's not very dangerous, meaning
Okay.
it doesn't go inside your body, it doesn't make you sick, but it will cause other problems. Nails get thicker, they're more difficult to trim, patients get ingrown toenails, or because of the fungal infection on the skin, they'll get drying and cracking and get, secondary infections because of that. So that is another problem that we see commonly.
Are there any, in regards to what we've already talked about, are there any remedies? Are there any?
Absolutely,
So what are some,
100%.
are there remedies that can make it go away?
Sure.
Or if you have diabetes, are you always stuck with?
You're not always stuck with that. It's more difficult to treat.
Okay.
Fungal infections in general are difficult to treat on the skin and the nails. There are multiple ways we treat them. We have topical medications and oral medications, even some laser treatments that are out there. There's always the option of just removing the fungal toenail if we have to. The problem becomes in diabetics is that one, sometimes we can't do any procedures on them because their blood sugars are completely out of control and they would get an infection if we tried to. And number two is that they sometimes can't take any of those medications. Like, the oral medication interacts with some other medication that they're taking, or it may affect their liver because they're taking cholesterol medications now. So that's the treatment is the problem. Also, one more thing is that patients try to kind of deal with it themselves. So they'll do a lot of home remedies on certain things, and sometimes, I don't want to say all the time, but sometimes they'll actually harm it. They'll harm their body more.
So bottom line is, if you have any home remedies, or, and being Armenian, we know there's a lot of remedies, talk to your doctor about them. There's never any problem with asking your doctor, hey, do you think this works, and what are the side effects with this medicine and that medicine? More when we come back about your feet. Don't go away. Welcome back. Adventist Health Glendale is ranked among the best hospitals in America, earning 3 straight 5-star ratings from the Centers for Medicare and Medicaid Services, and our 16th straight A grade for the patient safety from the Leapfrog Group. Congratulations, Adventist Health Glendale. Joining us from Adventist Health Glendale is my new favorite DPM, Dr. Narek Garukyan. Doctor, let's, with all that we were talking about, what is the most important thing you want all of us to know about foot care and diabetes?
The most important thing is for patients to be aware of that they can have a problem and not to wait. If they have an issue, they need to seek immediate attention.
Don't self-diagnose.
Don't self-diagnose, don't self-treat.
And also don't surf the web and find all these things.
Oh yeah, no, that's a horrible thing to do. Don't perform any bathtub surgeries like some of our patients have been doing. The most important thing is, visit a podiatrist, visit a specialist. Our job is to prevent complications to your foot. There's staggering, like we said, 50% of people get neuropathy. Well, 15% of people who have diabetes get an ulceration. And about 20% of those people will get an amputation because of an infection. So that's the thing that we, as podiatrists, try to prevent.
But also a lot of times too, if people that are suffering from diabetes and it's advanced, they can't feel it or
That
see
is
it.
that is the major problem. That's why
Okay.
they get the ulceration, because they will walk around, they use the wrong shoe or a new shoe or did something more than they should have, and they get a blister or they step on something and they cannot feel it, and it goes for days without even having any attention to it. So the most important thing also, on top of everything else that we talked about, is to visually examine your foot, or so have somebody examine your foot. Make sure there's no new cuts, no blisters, anything like that. If there's anything unusual, seek medical attention right away. Don't wait.
Because the worst thing that, as I'm reading this, is amputation.
Right. And we're talking minor or major amputations. You're losing your whole, losing toes or something like that, people can deal with, but losing your leg, that's not a very good kind of outcome for the patient as a whole.
So diabetes 1, diabetes 2, and neuropathy and all, is all of this treatable?
So diabetes 1 is treatable as far as, insulin.
Okay.
That's the treatment. Diabetes 2, it really depends on the stage of the
Got
disease.
it.
Pre-diabetic patients, 100% treatable, because you can modify activities,
And you can also
modify diet.
turn it around.
You can. I've had patients who've had major diabetes and uncontrolled diabetes, and they're very well controlled at this point. Unfortunately, when you get the neuropathy, it's pretty much irreversible.
Got it.
Because the nerves are damaged and there's no way to bring them back.
What are some of the let me ask you a question. So if somebody has diabetes and they're having trouble with their feet, what are some solutions and what are some treatments that people can do at home to take care of their feet, or to at least, I don't want to say reverse, because there's things we can reverse, but just add a lot more TLC to our feet? What
Sure.
can we do?
So for diabetics, the number one thing is to control the blood sugar. That is that precedes everything, because with the blood sugar being high, it's just going to cause more. It's a progressive condition, so it'll get worse and worse. It'll just keep going up your foot, up your leg, and then starting your hands. So blood sugar is the best thing. And again, just be wary of your feet. Make sure that they're doing okay. Physically examine them. I wouldn't really recommend any kind of self-treatment if there's something going on, but it's just basically common knowledge. If you have a cut, put some Neosporin or something on it. Go to your doctor. Don't wait, especially if you have uncontrolled diabetes.
What can we do just basically, generally, to take care of our feet?
Generally, what we can do is, keep your feet clean. That's like, the obvious thing, but it's not obvious to certain people, But keep your feet clean, wash them, keep them moisturized. If they're dry, there's a ton of moisturizers out there that can be used. Remember, you don't want to be using any moisturizer in between your toes, because that'll just cause more maceration. It'll just build up moisture. But keep them moisturized.
That creates athlete's foot, right?
That creates athlete's foot, yeah. So just hygiene. That's the best thing you can do for your foot.
And in regards to final thoughts, in regards to diabetes and health and wellness and general care, what do you want us to know?
I think, patients who are educated on it, they tend to do better. And when you go to your, endocrinologist or your primary doctor, and they actually give you the breakdown of what's going on with your diabetes, patients tend to want to get better.
Love that.
The problem is the non-compliance that we see. That's in every field. So patients not taking their medications, cheating on their diets, and all this other stuff, or patients who are they just don't care. So as far as patients who have diabetes and want to take care of their feet, I think visit a podiatrist or a foot doctor or someone that's a specialist in the foot at least once a year, if not more if need be. Also, again, don't self-diagnose and don't self-treat, because that's where the problems
And it's also
arise.
maintenance.
Maintenance. Yeah.
Doctor, thank you. So will you come back?
Absolutely. Thank you very much for having me.
No, thank you for having us. You heard it here. One step at a time. Don't take your feet for granted. Don't self-diagnose. Make an appointment once a year with a podiatrist. even if you don't have diabetes or you're suffering from neuropathy, your podiatrist will take care of the way you walk, how your feet are, your arch, all of it. One step at a time. Thank you for joining us. Remember, the most important conversation you're going to have is about you and your health. Remember to watch us on YouTube at Adventist Health Glendale, and also follow us on Facebook at AH Glendale, and I'm at GregoryZarian.com. Take care, be well, and don't forget to be kind. We'll see you next time. Thanks.